I'm Dwayne Brown. Tonight on KPBS Evening Edition, voters are heading to the polls as Election Day is underway, and there's not a lot of time left to cast your ballot.
Also ahead, mandatory drought restrictions began on Saturday. I'm Tom Fudge in for Peggy Pico, and we'll bring you some expert advice and tips for saving water at home.
And a program in southeastern San Diego aims to teach the chronically ill how to avoid the hospital and better manage their own health. KPBS Evening Edition starts right now. Hi, good evening. Thanks for joining us. San Diegans from across the county headed to the polls this election Tuesday with choices for governor, Congress, and many state and local offices. Water, health care, insurance, and propositions affecting criminal sentences are also being voted on.
We've had a considerable response of mail ballot voters dropping off their mail ballots. In fact, the line of cars have been stacking up to the point where we're planning on calling SDPD to come out to do some traffic control for us.
County Registrar Michael Vu speaking about the volume of folks driving by the registrar's office in Kearny Mesa to cast their ballots. A much greater response than the June primary, when only 27% of voters turned out. The lowest percentage in 30 years for a California governor's race.
I still am going to that 48 to 51%. Once we've canvassed those precincts, I may revise those numbers to see if it's higher or lower, but at this point in time, I'm going to stick with those numbers until we can touch base with our poll workers that are out there.
Candidates for San Diego's hotly contested 52nd congressional district dropped off their ballots earlier in the day. Democratic incumbent Scott Peters at his polling place in La Jolla, while his Republican challenger Carl DeMaio voted near his home in Rancho Bernardo. With more than 1,200 polling places around the county, Vu says it all comes down to how many people vote, whether at a polling place, by mail, or just dropping off their ballot. The registrar then has 28 days to certify the election.
Although many voters think that election night is the final official results, it doesn't really occur until December 2nd, which is the deadline for us to certify and make it official.
The first count will cover the number of absentee ballots received so far, and that will be released shortly after 8 tonight after the polls close. Well, no matter the outcome of the election, San Diego's first Asian American in 50 years will be elected to City Council. Education consultant Carol Kim is running against Chris Cate, who is vice president of the County Taxpayers Association. The two are vying to represent an area that includes Mira Mesa, Kearny Mesa, and part of Claremont Mesa, all neighborhoods with large Asian American populations. Across the state, voters are deciding on a number of statewide offices as well, such as governor, attorney general, and state school superintendent. Also on the ballot, 6 statewide propositions ranging from water to health care and sentencing laws. Voters are also deciding tonight who will control the U.S. Senate. Republicans can gain control from the Democrats if they pick up 6 seats. A GOP takeover would impact President Obama's agenda for the rest of his term and everything else Congress wants to do. Republicans lost their Senate majority in 2006, but still hold a majority in the House. Be sure to join us tonight for the results and expert analysis. Our coverage begins after the polls close at 8 o'clock with updates from 8 to 11 on KPBS radio and right here on television. Then join us at 11 o'clock tonight for a half-hour special. We'll have the latest from Election Central downtown, all simulcast on radio and KPBS television. Well, we're still watching on election for the election results, but we do know who the winners and losers are when it comes to saving water. The state released the first data that shows how much water is consumed per capita in California water districts. KPBS reporter Megan Burks ran the numbers, and she joins us from the newsroom with what she found. So, Megan, who's conserving the most water in our part of the state?
Rainbow, the small North County farming community, cut its water use by 13% in September. Now, I hesitate to call Valley Center the loser because it only saw a negligible increase, just a fraction of a percent. And it's also an agricultural region, but it was the only San Diego water district in the report to record an increase. The report compares the gallons of water residents and businesses used in September to the amount they used during the same time last year.
Well, winners and losers aside, did you get a sense of how we're doing as a region?
Well, the County Water Authority says there was a 4% decrease countywide in the amount of water we used in September. Again, that's compared to the amount we used in September of 2013. Statewide, there was a 10% decrease, so it looks like San Diego is lagging behind. But the Water Authority points out those savings are on top of a 20% cut in water use since 2007.
And of course, we are a little late in setting water restrictions here, right?
Right. Our water supply has been relatively stable compared to other cities, so the Water Authority didn't call for the restrictions until July. The city of San Diego's went into effect Saturday. Rules like turning off water features in your yard and watering lawns on designated days of the week. You can get more information on those restrictions and see water consumption rates in your area on our website, kpbs.org.
Reporter Megan Burks. With mandatory water restrictions in effect now, Tom Fudge tells us about a few things we can do to conserve our precious H2O.
Winter is approaching, and our prayers for a normal rainfall this season may be answered, but making up the water deficit of 3 years of drought will take some time. And this past Saturday, the city of San Diego instated mandatory water use restrictions for homes and businesses. Joining me to offer a few tips about how you can easily reduce your water use are Hala Razak, Director of the City of San Diego's Public Utilities Department, and Jason Foster, the Outreach and Conservation Director with the San Diego County Water Authority. And Hala, starting with you, how many gallons of water does your average San Diegan or your average San Diego household actually use every day?
You know, that's a great question, and that number fluctuates depending on the time of year and the number of people, of course, that live in the house. So the majority of the use is for outside use. For indoor use, in the month of September, our use per capita was about 82 gallons per day.
82 gallons per day. And Jason, does that represent some progress? Are we using less water than we used to?
Yes, actually, when you compare the region's water use from 2007 to 2014, we're down more than 20% per capita when you look at the total water use, including residential, industrial, and commercial use as well.
But Hala, I guess we're trying to reduce even more. What are the goals of the city?
The mandatory restrictions that we have really are concentrating on our outside use. So the residents and the businesses cannot irrigate more than 3 times a week, and there are specific days depending on the address, as well as some restrictions on washing cars, cleaning the sidewalk, and doing other things. Very specific restrictions.
Ornamental water use, fountains, what about those?
Not allowed. They are not allowed unless it is for maintenance. So in restaurants, they're not supposed to be serving water unless the customer requests it. In hotels, you have the option to request not to have your sheets to be laundered. So there are very specific restrictions that we have right now.
Well, Jason, let's talk about your average homeowner. What are some easy, simple things that people can do to affect their water use and reduce their water use?
Well, there's a lot of different and very easy things that they can do. Indoors, simply take shorter showers is one way, making sure you're washing full loads of laundry. Those things can save a lot of water, and they add up over time. Outdoors, follow the outdoor watering restrictions of your local watering agency. We have all of the different agency restrictions up on our website, whenindrought.org. But the other things you can do is just sweep your sidewalks to clean them instead of hosing them off. If you wash your car, take it to a commercial car wash, especially one that recycles water. That's a lot more efficient than just doing it by yourself.
I get the feeling that we should focus mostly on landscaping, the exterior, because that's where most of the water is used. So changing from a lawn to Mediterranean landscaping, that's a good idea?
That is a great idea. And that can save your water use by 20% to more than 50%. For example, the Water Authority recently changed out its landscape a few years ago, and we've seen a 56% sustained savings on our outdoor water use since that time. And residents and other businesses, if they do the same thing, can expect similar savings depending on, of course, design and the plant palettes they choose.
Hala, let's talk briefly about gray water systems, which people can install and create if they're ambitious. What is a gray water system and how easy are they to install?
The gray water system really takes the concept of recycling water to a really new, exciting level, where once you use the water in the dishwasher, in the washing machine, then it's still in a very good shape. You can then move it and use it to irrigate the plants outside. So depending on the type of gray water system you install, some of the simpler ones don't even require any permit. And the listeners and the viewers can really go to the website, the city's website, and get all the information on the gray water systems that we have.
Okay, well, thank you very much to Hala Razak and Jason Foster. By the way, you can find information on water restrictions and conservation at our website, kpbs.org.
San Diego and other parts of Southern California are under an elevated risk of fire danger because of windy, dry, and warm weather expected over the next couple of days. National Weather Service has issued a red flag warning for Inland Valley and mountain areas right through Thursday. The Santa Ana Wildfire Threat Index was increased to a level 3, meaning fires will grow rapidly and be difficult to control. Homeowners should also clear defensible space around their property. Firefighters quickly put out a small brush fire today on Camp Pendleton. It broke out on the southeastern end of the base, burning about 7 acres of open space. There were no homes or other structures threatened. Looks like San Diego's economic recovery is reaching new heights. A new report by National University System Institute for Policy Research suggests the county's gross domestic product may surpass the $200 billion mark this year for the first time ever. Even so, economists say San Diego's post-recession recovery appears relatively average, not as robust as similar metro areas, but stronger than others. Federal officials say the sickest 5% of Americans are responsible for more than half of all health care costs. They often have chronic health conditions and high rates of emergency room visits. KPBS health reporter Kenny Goldberg tells us about a San Diego program trying to help these patients better navigate the healthcare system.
LaShawn Encarnacion has a boatload of chronic health problems.
Type 2 diabetes, extreme morbid obesity, osteoarthritis, osteoporosis, high blood pressure.
And that's just the physical stuff.
And then we go into, of course, the depression. My official diagnosis is by borderline personality disorder.
Encarnacion has had a tough time the last few years. About every 3 or 4 months, he's gone to an emergency department. He's also been hospitalized. Encarnacion has health insurance, but he's run into plenty of red tape and denials of care. But lately, he's been getting some help.
It has been approved, so then the mattress and the walker and the cane, all of those things, we're going to start working through it. And then you had therapy yesterday, right?
Social worker Alicia Asado is helping Encarnacion get the benefits he's entitled to and get his health under control. She's part of a care management team that's at the heart of a program called the Patient Health Improvement Initiative. This grant-funded program targets chronically ill patients who lurch from one crisis to another, often ending up in the hospital and racking up enormous costs.
So, Ms. Braswell, how you doing?
Dr. Rodney Hood heads up the initiative. He says in some ways it's similar to Project 25, an effort that finds housing and seeks to improve the health of homeless San Diegans. But Dr. Hood says a majority of patients in his program have housing and insurance. They live in areas of the county like Southeast San Diego and National City, which have the highest rates of ER and hospital visits.
They go into the ER because of what we call social barriers. There's problems of lack of education, lack of transportation, food problems, not understanding the medications, not being able to get with their coverage into the benefits that they have.
Dr. Hood says his team works closely with each patient for up to a year. They help stabilize a patient and address the social barriers affecting their health. In essence, the team teaches patients how to improve their quality of life.
Not necessarily holding their hands, but teaching them and empowering them how to advocate and do it better in the future.
The template for Hood's program was created in 2007 in Camden, New Jersey, a city just across the river from Philadelphia. A doctor named Jeffrey Brenner used raw billing data from 3 Camden hospitals to identify high utilizers of healthcare.
We learned that 20% of the patients were 90% of the cost. Someone had actually gone to the emergency room 113 times in 1 year.
Brenner says instead of waiting for people to show up at the hospital, he formed a team to actively seek out chronically sick people and take better care of them. Using this unique approach, Brenner's team was able to cut hospital visits and costs in half. In 2012, Dr. Hood received a federal grant to fund a similar program in southeastern San Diego. So far, they've enrolled a total of 124 patients. The effort is the only federally funded program of its kind in California, and so far it's achieved some impressive results. A cohort of 21 patients from one health plan slashed their medical costs from $1.6 million to $960,000 in 1 year. Even when you factor in the cost of Dr. Hood's team, that's a 40% savings.
So do we have an update on any current patients?
The team meets twice a week to discuss cases and new referrals. They currently handle 26 patients. Nurse case manager Montrula Donaldson says the biweekly meetings are absolutely essential.
We're all there and we're talking together, and then we can see, okay, what do we need to do more for this patient? Or is this patient done? Have they met their goals? That's one thing that we do when we admit them, is that we set goals for them.
After patients are transitioned out of the program, volunteers call them once a week to make sure they stay on track. Lavelle Picou recently graduated from the program. To be sure, she still has severe health problems, including a bad hip and sickle cell disease. But thanks to the program, Picou stays on top of her medications and has greatly reduced her need for transfusions.
I don't know, I'm not sick all the time, so I wake up happy now, you know. I wake up, I can't get out of bed, my blood's low. When your blood's low, you're really tired, and you know, now that I know I have them on my side, so I can call for help if I needed it.
LaShawn Encarnacion has only been in the program about a month. He's really concerned about his health. But now that he's working with the team at the Patient Health Improvement Initiative, Encarnacion says he can imagine getting better.
I just want to be a productive member of society, earn a living, have my own apartment, maybe my own home, and just live a life that most people have.
The program's funding runs out next year. Dr. Hood says he's asking insurance companies to underwrite it, since they're the ones reaping the most savings from it. Kenny Goldberg, KPBS News.
More than 5,300 students at San Diego Unified suffer from a learning disability. KPBS reporter Meetha Sharma finds out what's being done to support students with dyslexia.
It's believed that 1 in 5 students can't read well because they have dyslexia. Recently, KPBS aired a story highlighting some of the challenges dyslexic students face in being diagnosed and getting the right help. Joining me to talk about the issue are Kelly Sandman-Hurley, who runs the Dyslexia Training Institute through the University of San Diego, and Sonia Picos, Executive Director of Special Education at San Diego Unified. Kelly, what is dyslexia and how common is it?
Dyslexia is a neurobiological condition that makes reading more difficult. So children with dyslexia have trouble decoding words, they have trouble with reading comprehension, they have trouble with fluency, they have trouble reading words in isolation, and they also have trouble with spelling. So it's really important to remember that dyslexia is unexpected in relation to their cognitive ability. So it's what happens when a child is able to learn, and we have evidence that they're able to learn, but for some reason that they're unable to learn how to read and to spell to their ability. And it occurs in about 1 in 5 children.
And Sonia, how does San Diego Unified test and identify these students, and what is the criteria for testing them?
So when, as a school district and as a system, we don't diagnose dyslexia, but we look at what potential learning disabilities there may be. So dyslexia being one of the areas that we would look into.
Why don't you diagnose?
That's not something that we do as a school system. So as a school system, we look at what federal handicapping condition a student may be eligible to make educational benefit.
So Kelly, as an advocate, what are the problems you see with the way the district is handling students with dyslexia?
The main problem is the services that are provided once they're identified as having an academic issue. So kids with dyslexia, as I mentioned earlier, have a neurobiological difference in the way that they're able to learn how to read. And so they require a specific intervention to help them rewire their brains so that they're able to read more efficiently. And so when they are identified, and it's usually a little bit later than we'd like, then they need the appropriate services administered by the appropriately trained personnel. And that's where the parents are really having the struggle.
And so, Sonia, I understand that there has been some criticism leveled at the district that once a student has been identified, whether it's usually through the parent, I'm guessing, that the parent goes and takes the child and gets the child tested?
It can happen two different ways. The parent can ask the district to assess for eligibility, but they don't ask them to diagnose.
And what is the eligibility criteria?
Specific learning disability.
Okay, so there's been some criticism leveled at the district that once a child has been diagnosed with this, that they're not getting the help that they need, that they are being treated possibly with a curriculum that's more tailored toward autism, but not tailored toward dyslexia. What do you say to that?
So I think it's important to differentiate, that yes, we wouldn't wait necessarily for a parent to come in with a particular diagnosis. If a student is showing any signs of need and the team, the IEP, instructional educational program, feels that we need to assess in this area because there is a suspected disability, then we do so. As far as the instruction, you're right. There are different methodologies. There are different instructional interventions. As a system, we look at not only the interventions as far as academically, we also look at what assistive technology can we offer. We also look at classroom supports that we could put in place. So we're looking at a bigger scope.
But are teachers trained to maybe look at signs that a student is dyslexic?
Absolutely. So teachers receive training on reading disabilities, and dyslexia is one of them. So teachers have a knowledge base as to what it is that they would need to work with specific students and different needs. So some of those do overlap, with what would be particular and needed for a student with dyslexia.
So, Kelly, what could the school district be doing to improve the situation for dyslexic students?
Well, and I would say that it's not just San Diego Unified. This is a national problem that occurs in every district in our country. And what they could do is train their teachers to see the symptoms and the signs of dyslexia as early as kindergarten, identify it in kindergarten, give them services in kindergarten, but really get those teachers trained so that they are trained to do the intervention, because just giving them an intervention in a book is not enough. That's only half the equation. The other half of the equation, that the teacher needs to be highly trained in what dyslexia is and why they are providing that type of intervention. So it's not, like I said, it's not just a San Diego Unified issue. This is happening everywhere. And there's just a lack of awareness of what dyslexia is among our teachers. We haven't had the experience that the teachers have been aware of what dyslexia is.
So Sonia, when you hear that there's this lack of awareness among teachers of what dyslexia is, how do you respond to that?
So again, I'm hearing it loud and clear. I think because our teachers, dyslexia is one of the reading disabilities that we look into. Absolutely, I think there's room for collaboration, and extended opportunities to make sure that we continue the professional development that we're offering our teachers.
Collaboration between whom?
It could be potentially between, systems, like the Dyslexia Training Institute. I know we have, as part of, actually one of our school psychologists is the current president of the International Dyslexia Association. So we are getting that feedback directly from experts in the field.
And we've got to close it there. Sonia, Kelly, thanks so much for coming on the program.
Thank you.
Thank you.
A pollution alert is in effect tonight in Imperial Beach after an influx of sewage-fouled water from Tijuana. That warning covers beaches from the San Diego-Tijuana border to the south end of Seacoast Drive in IB. Warning signs of contamination will remain up until it's safe to go back into the water.
I'm Gwen Eiffel on the next News Hour. It's Election Day. Tune in for the latest results and analysis on air and online. Plus, a special report at 11 p.m. Eastern, Tuesday on the PBS News Hour.
Look at here, Sacramento already getting into the holiday spirit. The Capitol Christmas tree, it's arrived. It's a 60-foot white fir from the state forest near Redding. The 5,000-pound tree will be decorated over the coming weeks, just in time for the tree lighting ceremony December 2nd. 10,000 LED lights and handcrafted ornaments will cover the tree once it's decorated. Our fall warming trend is expected to continue through Thursday with a red flag warning we told you about of fire danger in the valley and desert areas. Coastal temperatures, though, in the 80s for the next couple of days, slightly warmer for the inland valleys, as you can see. Likewise for the mountain areas, desert temps mostly in the 70s. You can find tonight's stories on our website, kpbs.org/evening edition. Thanks for joining us. Have a great night.